Which of the following best defines the primary role of a nurse educator? A. Delivering bedside nursing care. B. Developing and evaluating educational programs. C. Managing hospital budgets. D. Scheduling clinical rotations only. Answer: B. A nurse educator's main role is to design, implement, and evaluate educational programs to prepare and mentor nursing students and practicing nurses. Which learning theory emphasizes that knowledge is constructed through experience and reflection? A. Behaviorism. B. Humanism. C. Constructivism. D. Cognitivism. Answer: C. Constructivism focuses on learners actively building knowledge through experiences and reflection rather than passively receiving information. The most effective teaching strategy for adult learners is to A. Use lecture-only methods. B. Focus on rote memorization. C. Relate content to real-life experiences. D. Avoid learner participation. Answer: C. Adult learners benefit most when education connects with their life experiences and professional practice, promoting self-directed learning. Which evaluation tool best measures psychomotor skills in nursing education? A. Essay exam. B. Clinical performance checklist. C. Multiple choice test. D. Case study analysis. Answer: B. Clinical performance checklists are used to objectively assess psychomotor competencies and technical nursing skills. What is the first step in curriculum development for a nursing program? A. Selecting teaching materials. B. Writing learning objectives. C. Conducting a needs assessment. D. Developing evaluation methods. Answer: C. Conducting a needs assessment identifies gaps between current knowledge and desired competencies, guiding curriculum design. The term formative evaluation refers to A. End-of-course assessment. B. Feedback given during learning. C. Faculty performance review. D. Summarizing student grades. Answer: B. Formative evaluation provides feedback during instruction to help learners improve performance before the final assessment. Which of the following is an example of higher-order thinking according to Bloom's taxonomy? A. Memorizing medication names. B. Explaining a nursing concept. C. Applying sterile technique. D. Designing a patient education plan. Answer: D. Designing a plan requires synthesis and evaluation, higher-order cognitive skills in Bloom's taxonomy. Which principle of adult learning is emphasized in Knowles' andragogy? A. Dependence on instructor direction. B. Motivation by external rewards. C. Relevance to professional goals. D. Passive reception of content. Answer: C. Adult learners are self-directed and value learning that is directly relevant to their professional and personal goals. Which type of assessment measures a student's competence in real-world practice situations? A. Paper examination. B. Simulation-based assessment. C. Online quiz. D. Attendance record. Answer: B. Simulation-based assessment allows learners to demonstrate applied knowledge and critical thinking in realistic clinical scenarios. A nurse educator uses a case study followed by group discussion. This teaching strategy best promotes A. Rote memory. B. Critical thinking. C. Passive learning. D. Time efficiency. Answer: B. Case-based learning encourages learners to analyze, synthesize, and evaluate information, key elements of critical thinking. In test construction, the term reliability refers to A. The accuracy of a test in measuring what it intends to measure. B. The consistency of test results over time. C. The difficulty level of questions. D. The number of test items included. Answer B. Reliability measures how consistent test results remain under similar conditions across multiple administrations. What is the purpose of a course objective? A. To describe the instructor's preferences. B. To outline expected learner outcomes. C. To define institutional policies. D. To summarize course content. Answer B. Course objectives specify what learners should know or be able to do by the end of instruction, guiding teaching and evaluation. Which assessment type best identifies students at risk of failure early in a course? A. Diagnostic assessment. B. Summative assessment. C. Peer assessment. D. Final exam. Answer A. Diagnostic assessment occurs before instruction to identify learning gaps and predict areas needing support. Which instructional method is most effective for developing clinical reasoning? A. Lecture. B. Role-playing. C. Flashcards. D. Memorization drills. Answer B. Role-playing encourages learners to apply knowledge in context, enhancing decision-making and clinical reasoning. Which of the following demonstrates the effective domain of learning? A. Performing in fore insertion. B. Understanding anatomy. C. Showing empathy to patients. D. Calculating medication doses. Answer C. The effective domain relates to attitudes, values, and emotions, such as empathy and professionalism. Which item format is most commonly used in nursing licensure exams like NCLEX? A. True/false. B. Essay. C. Multiple choice. D. Matching. Answer C. Multiple choice items are used to assess critical thinking and application of knowledge efficiently and objectively. A nurse educator wants to improve test validity. What should be the primary focus? A. Writing more test items. B. Aligning questions with learning objectives. C. Adding more distractors. D. Increasing test time. Answer B. Validity improves when test items align closely with course objectives and intended learning outcomes. Which feedback method is most effective in promoting student improvement? A. Delayed written summary. B. Immediate, specific feedback. C. General class discussion. D. Final grade posting. Answer B. Immediate and specific feedback helps learners recognize strengths and correct errors while the experience is fresh. Which teaching approach best supports diverse learning styles in a classroom? A. Uniform lecture delivery. B. Multimodal teaching methods. C. Single textbook reference. D. Strictly online assignments. Answer B. Using multimodal strategies, visual, auditory, kinesthetic, addresses various learning preferences and improves comprehension. The purpose of a teaching portfolio for a nurse educator is to A. Track student attendance. B. Document teaching effectiveness and growth. C. Replace performance appraisals. D. Collect student grades. Answer B. A teaching portfolio showcases an educator's philosophy, achievements, innovations, and reflections to demonstrate professional growth.